Hey, what's up, everybody? We are coming to you from Martinsburg, West Virginia. We want to thank everybody for tuning in tonight. We're going to talk about TMS. We want to thank you for tuning in. We also want to thank Sean Singh, aka Dip, 2H Media for broadcasting this podcast. So let's talk about the definition of TMS and what TMS stands for everyone that doesn't know the definition and what it stands for. TMS stands for transcranial magnetic stimulation, and I'm going to give you the textbook definition just so I don't mess this up. It is defined as a series of short magnetic pulses to stimulate nerve cells in areas of the brain that are associated with major depression. So a lot of people think that electroshock therapy and TMS therapy are the same things. They're very different. Electroshock therapy is when they actually induce a seizure. They put you under anesthesia, they induce a seizure to kind of reset the brain, and it can cause major memory loss. So with TMS, it's non-invasive, it doesn't cause memory loss. They do not put you in a seizure state. It's completely safe. There are no side effects. The only side effect that could be is maybe a slight headache, but when I took the treatment, I did not get any headaches. Did you get any headaches, Brian?
No, I didn't receive any headaches at all. No.
Okay. So, yeah, that's very rare. The other thing about TMS is not only does it not have side effects, but it's no pills. Pills have a lot of side effects, and sometimes they don't even work. So, why would you want to go through pills and have side effects when you can do TMS and have no side effects? And even with pills, if you don't have initial side effects, there are long-term side effects that can happen later if you're on pills for a long time. Not saying pills are bad, because they do work for some people. But this is an alternative to pills if you've tried a lot of pills that don't work. Or if you've been on pills for a long time and those pills stop working, which is what happened to me, the pills stopped working for me. So I had to seek out another treatment. So let's talk about the process. I'm going to hand it over to Brian. He's going to talk about how it works, the process.
Okay. Hello, everybody. My name is Brian Barnes. I'm here with Noel. We're talking about TMS and the improvements that we both have seen with the treatment. So how does it work? An electric pulse generator or stimulator is connected to a magnetic core connected to the scalp. And then you're fitted with a cap that the pulses stimulate through the cap, so it's not really touching your scalp. It's just remarkable. I saw improvements within 3 weeks. It's been around since, what, 1985?
Well, 1985 is when they first introduced it, but the trials actually didn't start until 1997, and then in 2008 it was approved by the FDA.
Okay, wonderful. Well, I think since we're on a time limit and we want some of our people out in the audience to speak, and if you have any comments or any questions like that, please hit the live stream up. But we did a song. It's called TMS Song, and that's the clean version. And I did a explicit version also myself, explaining some type of childhood trauma and all this type of stuff, but I'm not going to let you listen to that. You're going to have to follow us on Spotify and stuff like that. But I want to get into the song, the TMS song, because I think it's important and we want to share it with our veterans and our civilians also.
Yes, and if you want to search for that, blast up close.
Mystery Woman Music.
Yep.
Click, 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 click. Click, click, click. on the TMS dream shit.
You suffered a long journey, you don't know what to do. You tried every pill that they thrown at you. Nothing is working and you feel like giving up. You're tired of always hurting and feeling like you're stuck. You need a better treatment. You tried everything, now you're suicidal, and it's such a scary thing. Well, I went through all of that just last year, now we feel it is our duty for us to share what it was that helped us so we can help others. There's hope for us now, my sisters and my brothers. Works better than pills, works better than talk therapy. It's another way to treat for mental clarity. Around since 85, but not many know about it. And so that is why we wrote a song about it. We want to educate you because it's so important. It could help lots of people, so let us be your informant. Just 3 minutes a day for just 6 weeks. That's all you gotta do to get you some relief. Helps with major depression and PTSD. Have you feeling right? No question. And you best believe there are no side effects, and it also helps with sleep. This treatment is the best, everyone that's tried it agrees. If you're feeling down and depressed and you can't get no rest, you need to holler at your doctor and get that TMS. 6 weeks, knock it out, say less.
Click, 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 click. Click, 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 click. Click, 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 click. I'm on that TMS dream shit. We're back. I hope you enjoyed the song. You know, what was it, like 5 takes that
we did 5 edits to perfect it.
But it really was refreshing to get back into a craft that was long forgotten. And I think once I started my TMS treatments, a lot of things came back to me. I saw more drive in myself within the first 3 weeks. You know, I was doing things that were uncommon, you know, like housework, you know, not trying to throw my wife under the bus or anything like that, but automatically I just was doing things that I put off, you know, and it's just a wonderful feeling. And I want to talk about the song a little bit, what you just heard as far as the drug addict and scenarios as far as with drugs. I just like to say TMS helped me get off of drugs. You know, I'm no longer taking my medication, which I don't prescribe. I'm not trying to say that medication is something bad or anything like that, but this TMS, I saw major improvements that I didn't see by taking the medication, you know, and I just want to feel this way. You know, the way that I'm feeling now, I'm content with myself, you know, and I just like to say that if you're seeking help, get your help. You know, if you need a therapist, get a therapist. But this TMS program is really worth pursuing or trying to take a look at.
Okay, so I guess my story and the angle that I'm coming from with this is that I had a traumatic event happen to me about 20 years ago, and ever since that event, I've been on medications over the years, and those medications did help me for a while. They did work for a while. Every few years I'd have to change medications because they would just stop working. And I think I got to the point with being on them for so long that they just stopped working because I'd been on so many different ones. And I know a lot of people that face that issue. They're on medicines and they stop working, and then they have nowhere to go because they've already tried all the medications out there. So I actually last year, in a time span of about 18 months, went on 8 different medications. Wow. And I want to stress that the side effects were terrible. One of the medications caused a rash all over my body. I had to go to the emergency room. Another medication caused me to have restless leg syndrome. I was kicking all night long. And then other ones just didn't work, or they made me feel like a zombie. And, you know, my friend Will, who's out here, he was the first patient to go through TMS. He told me about it, and he convinced me to try it, even though, like Brian, we were both scared to do it. We didn't know if it was going to make things worse. We didn't know, if it was going to have side effects. But we later found, after talking to the doctors, there are no side effects with TMS. So that's a big thing. And yeah, I just want to thank you, Will, for telling me about it, because I wouldn't have known if Will wouldn't have told me
about it.
Yeah, and then I told Brian, so it was like a domino effect.
It is.
It was
that's
networking.
what we're trying to do right now.
Yeah, and that's why we're doing this, is to put it out there more, so it's not just a friend telling a friend, but we're actually putting it out to everyone so they can know more about it and not be scared to try it.
Yeah.
But yeah, I think, Will, you should come up here and say something. Do you want to come up here and say something?
Well, before I forget,
Okay.
I wanted to mention that we're working very closely with VAMC, and we're trying to get something done with public affairs to try to make a video with this song. We have a liaison, Ms. Crawford, that we'll be contacting, and if people want to get into the video or something like that, just give 2H Media a contact. Will, you're going to speak?
Yeah, come on up here. I'll let you take my seat.
You can sit right here.
Oh, you okay. Yeah, me and Will worked together at the VA for several years. Yeah, and Brian was there too.
And I was down there.
I just didn't know you back then.
Yeah. All three of us work together. Relationships are important to me. Friendships I value a lot. And like all three of us, we work together. Noel sold me my house 4 years ago.
Yep, I remember that. It popped up in my memories yesterday.
Yeah, so so we all have connections. A little bit more on my story. I had a traumatic event, a little bit of a PTSD memory of being on a ship in the Navy. And unfortunately, I lost a relative on the USS Cole. And so I would get nightmares being out there patrolling the waters of the Pacific Ocean in Japan and stuff. But if you're in the military, the moment you open your mouth to say something, they are sending you to medical. They are trying to get you evaluated and try to say you're not fit for duty. So I pretty much kept a tight lip on it for a long time. And good. Okay. Also, when I got out, had a lot of issues with my marriage. Raising, I was young and still had a young kid. Then I had another child. Then eventually ended up getting divorced. And working a job at the VA that demanded a lot, because at the job that I had at the time, I was helping other veterans deal with their problems, and that was another issue that just like weighed down on me. Deal with my personality and my emotions and stuff. And then once I got terminated and everything just started to like spiral and just get deeper and darker. And I was talking to my provider, and just like I was on several different types of meds. They upped the doses. I stopped taking them. And then she told me about TMS, how it was new treatment that the VA was offering at the Martinsburg facility, and I was like, what else do I got to lose? So I'll try it. And the version of TMS, the TMS treatments that I went through were a little bit different than what Brian and Noel went through. my process was a little bit longer. The pulses were each session was maybe about 20 to 25 minutes, as opposed to a 3-minute session, because the treatment that they received, and I'll get to this in a second, but I'm on my second round of treatment. It's called the theta burst, and it's short bursts compacted together in 10-second increments. Whereas the traditional version were about 19 seconds each, and it was single taps. So it pretty much kind of felt like a woodpecker, like just
click, 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 tick, tick, tick.
Yeah, exactly. You know, and so the process was still the same. There was a tapering effect towards the end, so I did 30 treatments. Excuse me. Then I did 6 where it was a taper off to give lasting effects, and I went through that process last year, and that lasted for a good year. So with me going through the second round, I'm now going through the theta burst, the version that Noel and Brian went through. I realized it was a little bit of a shock to me at first, because it wasn't the traditional, way. And so when I felt it, I was like, oh.
Was it more like potent? Did it hurt more? Or?
Well, at first it was a little more because it's in bursts, know.
Yeah.
So just to get into that feel versus the tick 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 tick, it was odd. Like the first.
Yeah, can I ask you a question?
Yeah.
Are you still on medication?
No.
If you don't mind me asking.
No.
So you felt that after a year of taking your treatment that you needed to renew it?
The treatments?
Yeah, again.
Yeah.
Okay.
Yeah, it was.
That's what I'm trying to. I don't know if I'm going to end up going through that.
Because I was asking them, and for what Doc was saying, that there was about usually like a 6 to 8 month sustainability before people would possibly start to get effects of doing it again. I was like, oh, okay. And so after my last treatments in October, late October of last year, it got me all the way up to this point. So it was about close to a year.
Wow.
So
That's good.
Yeah.
So
That's wonderful.
And from that point to now, I haven't been on any depression medication, and it also going through this treatment also made me self-aware of acknowledging that, hey, I'm starting to feel this way again. Let me get ahead of this and call my provider, see if we can put me back on, get me in the rotation.
Before it got worse.
Before it got worse.
Exactly.
Proactive.
I think we all recognize certain elements within ourselves after this treatment. I mean, you can look at yourself indirectly and feel the difference. And I think you're more resolved to handle your problems after this treatment,
Absolutely.
And I'm not going to cut you off. We're going to hear more from Will, but we're on the time frame. I like to let everybody know I've been an advocate for veterans for a very long period of time. Me and my son, right? Here. Yeah, for over a decade. And we made a short film on PTSD, and I think we're going to run a little clip on that, and then we're going to get right back into the TMS.
And just, you didn't mention, so I want to mention that Brian is a Desert Storm veteran.
Yes.
Yeah.
Thank you.
So.
usual remedy, which is prescription drugs, just suppresses my problem. And talking to someone who has never been through the same experiences also didn't seem to be an effective method. I truly believe my method of transferring someone's inner thoughts onto film is a legitimate medical rehabilitation method. Hey, we're back. That was a movie we did about 2 years ago. I'm very proud of it. It's independent. It's getting around. It has over 80,000 views, and we're trying to get into the VA system. But right now, we're going to talk about who is not a good candidate for TMS. People that's prone for seizures, epilepsy, or drug and alcohol abuse. Because you can't be dealing with drugs while you're taking the therapy. And that was one of the reasons why I'm off drugs now today, on a recovering addict, and I'm proud to say that I feel a lot better within myself, with the outcome of that. But for the civilians who might be interested in TMS, if your insurance doesn't cover it, it's going to be about $15,000. So veterans really feel fortunate that we can get these procedures just off the cuff that we served our country, and I'm so grateful for that.
That's awesome.
Yeah. And Noel, you could talk about the success rate of it?
Before I go into that, one other thing as far as the insurances. Some insurances will cover it if you've been on one medication or more. That's all it takes, just one medication to get it approved. Some other insurances, you have to be on 4 medications before they'll cover it. And I'm not sure about which ones are which, so you just have to research that on your own to find what your insurance company requires for that. And like you said, if you pay out of pocket, it's like $15,000.
Yeah.
But most insurance will cover it. And so I guess the last thing before we get into the question and answer session is the success rate. TMS has a 50% success rate,
Yes.
which is really good because some pills don't even have that. They have like 30% success rate. So you've got a 50, and that is for complete remission from depression. Complete remission. Now, if it's not a complete remission, then it is 50% improvements. So even if you don't come out with complete remission, it's still a 50% improvement of your symptoms. So yeah, I mean, it's like Brian said, what do you have to lose?
Yeah.
If you're depressed and you've given up hope and you're like me, I was suicidal at one point, you have nothing to lose to try it.
Yeah.
But everything to gain, because the worst thing that could happen is it just doesn't work. It's not like it will make your depression worse. It just doesn't work for you. So you have nothing to lose to try it. So I guess we can start the question and answer session.
I had the staff turn off because I was just kind of curious of like the locations of how many VAs or and across the nation and including Puerto Rico, there are currently 59 VA medical centers or outpatient clinics that offer TMS.
That's really good.
Us, just in the, I would, so we're not too far from the DMV area, so I would just say that the DMV area in the West Virginia, us, the DC VA also has a TMS team. and the Lewis Johnson VA in Clarksburg. And I thought that was also important because, we're all connected together by the military, and we all served at one time period or another, and we all have service members that we keep in contact that live throughout the country.
Yeah.
So I figured this was a far-reaching way to help some of our fellow brothers and sisters that, we may not technically have served with, but we've all served.
Yeah.
Right.
To
get the word out.
To
to
get the
them.
word out
Yeah.
to them as well. Because they may be in California or Washington State or Illinois somewhere and don't know that their VA offers that treatment.
Right.
So I thought it was important to find that information out.
And we appreciate that.
Yeah,
You're
thank
June,
you, Will,
man.
for doing
Thank you, Will.
that. Yes.
And thank you for being the first, man.
Yeah.
Get this across because, like you said, it was a domino effect. If you didn't tell Noel, she would have told me. And I feel much better. And I appreciate that, man, because that was sort of brave to do.
Yes.
And like you guys, through the years when we all worked at the VA together, I've always been, that happy-go-lucky guy on the job.
Yeah.
Talk to any and everybody. But what a lot of people didn't know that I was really suffering inside. A lot of the time, the majority of the time that I was actually working there. But I always kept a smile on my face. And
You did.
Wearing that mask.
I would have
Yeah.
never known
Wearing that
because
mask.
you were friendly to everybody. You were
Yeah.
always,
Yeah.
Yeah,
you
and
kept that energy up.
So nobody, really saw like the ugly side of me because when I was always at work, even when I would have a disagreement with somebody, it'll fall. It wasn't too serious. It'll fall by the wayside.
Mm-hmm.
But for the most part, everybody that I came in contact with, I always had a smile on my face. Laugh, share the joke with them.
Yeah.
Yeah.
Or like we did, smoking joke.
Yeah.
Smoking joke.
Yeah. Before they took us smoking off the can, made a non-smoking cannabis.
Can I mention something before I forget? Because I've been trying to press on and try to get this thing, and I know it's no descriptive references to this as far as with drugs or anything as far as the treatment is going, but I'm doing some aftercare with the SUDS program at the VA, and that's very helpful also. So I'm saying that you do have to still put in the work, but it's worthwhile if you do. I want to save lives, and being an advocate is speaking for veterans in the way that they feel, and I'm just so proud of everybody that came here today, and I just want to thank you guys. And let's just try to get this word out the best way that we can. Let's get this word out.
Yeah, I think it's awesome.
Through music, through movies, through whatever we have to do, And I do want to work with the VA. I want all of us to work with the VA because I think that they need to hear specifically from the veterans, of what's going on and how we feel.
And about our facility in particular, they are now, I believe, screening Cat 5 patients.
Wow.
And PTSD program patients. And so the guys that are up there that are going through their issues, at that moment. I mean, I was fortunate enough not to be a veteran to have to go through a program, but I know a lot of veterans out there that have, some several times,
Yes. Well, you don't have to be a veteran to have mental problems.
No,
Mental illness, and I'm not saying you said that, brother.
But I'm saying as far as like the umbrella within the VA, what we've all been familiar with and accustomed to, seeing veterans and meeting, friends that people that become friends through one of these programs, or just helping a veteran out with a situation. Next thing you know, they remember you helping them out, and then you befriend them, and you're a friend. That's pretty cool. They're trying to implement the TMS program within those Cat 5 programs.
That's wonderful.
in the PRP program.
A lot of good.
to help the veterans as well. And I think, that'll help accelerate, saving more veterans' lives.
That's right. That's what it should be about. Exactly.
Because I'm sure we've all heard a horror story of, they went through this program, that program, and the third, and they find out they're doing good for a little bit, and the next thing you know, they fall off a cliff, and next thing you know, they're worse off than when you first met them, or even worse case, they end up dead.
Overdose.
Or suicide.
Yeah, or suicide. Yeah, and it's really unfortunate.
Yeah.
To the families, to themselves, that may have had a lot more life to live, and to be able to experience more, that was cut short, tragically.
Right.
And also, I just want to point out too, just the other day, Doc shared with me that I think Stanford University out in California, because that's where they had to go to get the treatment. I mean, to get the
approval.
Well, not get the approval, but to go through the training.
Oh, okay. I understand
of the TMS program. Stanford is now doing trials on a more condensed version of the treatment, and it's twice a day for 15 days.
Is it the deep treatment? The deep treatment, I think it's called.
I can't remember what he said it was, but he said it's more condensed.
Wow.
So it's like,
how to give you 6-minute bursts.
So 15 treatments.
Yeah.
Twice a day.
Yeah.
It's like once in the morning.
Wow.
Once a day, and there's another version where they're doing the treatments for 3 days. So once every 10 hours. So for 3 days straight, once an hour, you're getting your brain stimulated, and they're trying to figure out the trials and get some studying on that as well. So they're really trying to figure out a way to crack the nut that's considered depression.
Yes.
Yeah. I think I heard that there's also going to have it in emergency rooms, and that they can actually do it when you come into the emergency room, and it's like an immediate thing. Like, I guess it's a really powerful treatment.
Wow.
I was reading about that too, that they were going to have that on deck at emergency rooms.
Speaking about reading, TMS Untold Stories coming out Veterans Day.
Oh yeah, it's gonna. What is it? 300 pages, right? Yeah.
15
and
chapters.
I don't know if there's even any books
Narrated
on TMS.
and directed.
Yeah, he's gonna do an audio book where he talks on there, and also the printed version. So y'all check that out. Veterans Day, right?
Yes.
Yep.
Yes. We've been working around here.
Yeah.
Would anybody out there like to say anything?
Any questions?
I got a question for you guys. Brian, I know you said that so you have to be clean of alcohol or drugs or anything before you start the treatment.
Yes.
To be able to start the treatment.
Yes, that's because the risk of seizures. You know what I'm saying? That they tell you to do, and it scared the hell out of me. You know what I'm saying? That's why I stayed clean throughout the process. Because I didn't want to be in that chair getting stimulated and then fall out on the floor. You know what I'm saying? So, I mean, when you feel you have consequences and stuff like that in your life, sometimes your mind will make that shift and a change for the better within yourself. You know what I'm saying? And that's exactly what happened to me. But no, you can't be on drugs or liquor or anything like that. At least they don't suggest it. You know what I'm saying? So,
the reason I was asking is because, you talk about veterans, I get you guys veterans, but I'm looking at it as a person in recovery, person dealing with depression,
yes,
with distress, with the addicted personality,
right.
So what it is I'm thinking about TMS being incorporated maybe as like some MAT, maybe to help with like substance use disorder, because you said it helped you.
It did.
From with your your use issue,
yes,
as far as your recovery. So I'm thinking, I was like, man, is that good. It could be good for people in recovery. You know, actually, you know, something to incorporate maybe after treatment, after people go to rehab, because they have to get clean first. You know, then go through a TMS process. That's the reason why I was asking, because can they just go straight to it, or no? You have to go through that detox period. You know,
I'm not the one to say that you're going to be approved for it or not. I know that you would have to talk to a doctor first. You understand, and seek some type of therapy. I'm assuming before they would probably even consider you for the TMS program, unless you have really in your charts or something like that as, you know, suicidal tendencies or thoughts or something like that. You know, but I understand that everyone goes through depression and stuff like that. You know, and it did help me with my issues and stuff like that as far as the drugs and stuff like that. But I mean, I don't think it's any documentation yet on that stating that that's what TMS is for. So I'm not going to really go outside the rim with that, because it's mainly for depression and PTSD. You know what I'm saying? But I took the liberty to help myself kick my habits and my demons at the same time. So
and it's helped you.
Yes, it did. Yes, very.
Also, going into, because I know you said there's no side effects. You guys said there's no side effects as far as, you know, after treatment or whatnot. But actually, in actual treatment, is it painful going through it, or do you feel anything while you're going through it? It's just, I know you said you had a cap or something like that.
It's not painful.
It's not.
It's not painful.
It's not. It's a minor discomfort. That would probably be like the most. I would probably say is just a minor discomfort, because it's something that you're not used to. You know, it's just like, you know, when they go to draw your blood, we're getting IV. You know, you're not used to getting blood drawn or getting the IV stuck in you. So that little bit of pain and discomfort, you know, that's about all you feel. You know, on a lighter note with the side effects, I will say that you get a lot of nap time in with the sessions. I know for myself, you know, being a disabled vet and I don't work, and, you know, just being a single dad, you know, when I come home, if I'm not doing stuff around the house or doing something to occupy my time, I might, you know, put on ESPN or something like that, or may play some video games for a little bit, and the next thing you know, I'm taking a nap. You know, and it's a nice peaceful nap, like in the middle of the day. And
because it helps with sleep also.
Yeah.
You know, it does help your sleep pattern, and you know,
absolutely. And a person, and also, you know, one of my service connected disabilities is sleep apnea. So having sleep apnea, you know, before I was bad with sleeping with my mask, you know, and that also affected, you know, my time on the job as well. You know, being late to work. You know,
I do remember you being late for work,
see?
but I was late too. We rolled in there together.
Right? Yeah. So so going, you know, back on the treatment and then back on it again, like I've really become, you know, a better steward of making sure I use my machine. And I definitely can tell the difference using my machine, sleeping, and then getting up in the morning, feeling refreshed, go get my treatment. Might take a nice little nap midday, you know, then it doesn't take me forever to fall asleep, or when it's time to go to sleep.
Yeah,
you know, like
that's true.
I get around the house, you know, I tell the kids, they all tell me good night. I mean, if I feel like staying up, I'll stay up. But if I feel like I just want to go to sleep, I'll just start shutting everything off. Tell the kids I love them good night, and next thing you know, I'm asleep.
Yeah.
So
that's one thing. I had insomnia. For like almost a year, I could not sleep at all. I had insomnia. I mean, when I say I couldn't sleep, I mean, I'd lay down in the bed, but I never got to sleep. And with the TMS treatments, it changed. Like, I could fall asleep.
Yeah.
You know,
and that's one of the questions they ask you each time before they give you the
How many hours you sleep last night?
How was your sleep?
Yep.
That's the first thing the doctor would ask you.
Did you change any medication?
And they're great doctors down there. Dr. Sampali and
Wendy and Chris.
Wendy and Chris. I
Dr.
mean, it's just a wonderful
Biagio.
staff to deal with as far as getting your treatment. You know, you look forward to seeing those guys every day, and you look forward to the treatment as well because you're going to see improvements.
Yeah.
You know, as you go.
And I will also say another great thing about the treatment, it's flexible. You know.
Well, you have to be consistent with it for 6 weeks.
Yeah.
You know,
yeah.
so-
The consistency part is, but what I'm saying as far as, when you have a class every day or you're supposed to be at work at 8 a.m. That's your time to be at work, 8 a.m. every day, right? With the TMS treatment, let's say you might get there 8:30 to 8:30, then another day you might come in there 9:30, 10:30. Sometimes you might send them a message like, "Hey, I might not be able to make it in the morning. I'm gonna try to make it in the afternoon." So they're very flexible with, sometimes things come up. We're all human. Things come up.
Yeah. But you don't want to miss the days.
Right. And the good thing is, like, they'll just tack a day on the back end if you happen to miss a day.
Yeah.
Just like if it was a federal holiday. Of course, they're not working, so they just tack the day on.
Exactly.
Like so far, like I'm actually, I in this go around, I had to already tack 1 or 2 days on the back end because I missed Tuesday. I had something come up with one of my kids. Tuesday, and then last Friday I missed, so they just put them on the back end.
Okay.
But coming around 9 a.m., coming around like 8:30. I think what was it yesterday when I saw you?
Yes.
I think I got there maybe like 10 o'clock. Wendy had called me. She was like, "Hey, Mr. Gunner, you still coming in?" "Yeah, I'm coming in." Like, but it's a little late, but I'm coming in.
I'll be there.
So, right, exactly. So,
does anybody have any more questions, or is
Yeah.
there any? Do you have another question, sir?
Now, I mean, I'm very interested in the TMS, and because I struggle with PTSD, but it's not through service. It's through traumatic events and just
Right.
life in general.
Okay.
So, and I'm a recovering addict myself, so I don't, likewise, I don't like none of this medication they try to put you on, and they try to give you so many different ones, and the side effects are the main thing, the feeling afterwards. So, I mean, it's definitely interesting to know about this, because I didn't know nothing about this, and it's funny how things work. You guys told each other, found out, about each other and stuff like that, and I'm finding out through you guys. So
Yeah.
it's
So you might be
it's
next.
definitely
Yeah.
spreading, and it's something good to look into because if it's it don't got no side effects and it's not painful and it's like what Noel said, what do you got to lose?
Right.
Give it a shot, especially for people in recovery. I just lost a friend to suicide last
Yeah.
week.
oh, sorry to hear
I
that.
think I know what you're talking about.
I'm like, wow, it really hurt me, but it also got me thinking, like, man, what if
It's
we
rough out here.
would have tried this program out? Because a lot of people you might think that are out there strong and stuff like that, and you don't know what you're going through on the inside, man. If something that can help with your brain and stimulate
It's
your brain,
true.
and deal with that depression, it's if it's something good, I'm for it. So I'm pretty much excited for it. Thank you for you guys sharing and putting info out about it.
Okay.
But
Good.
I'm all out.
And thank you for coming, Cubes.
Talk to your healthcare provider.
And I'm sorry about
man.
your friend.
Yeah.
Yeah.
And
I'm definitely gonna look into
Dr.
it.
Doses. Talk to your healthcare
Definitely gonna
provider
look into it.
and ask them about it and see what's going on. Let me know if I can help you any type of way. I will. You know that.
Definitely.
Same here.
Thank you.
All right. So, any other questions? I guess we didn't really check the online questions.
Did you see anything pull up?
Well, I can't actually access that. I don't know why. And I actually turned my phone off because it kept beeping.
Oh.
Dip, can you see any of the
No,
questions?
no
No?
questions.
Okay. Well, I think we covered pretty much all the the bases. I think we got some good information. Well, you gave some really good information, and Brian, you too. I mean,
And you as well.
yeah, so I think we did a good job here today by explaining some things, and we hope that you, took something away from this. And if you're thinking about doing it, I hope this maybe encourages you to try it.
Yeah. Okay. All right.
You know the beautiful thing I think about with veterans, that of course we all serve. We all know someone that lost their lives. That's the flip side of the bad coin of it. Excuse me. But just the stories that you hear from veteran to veteran to veteran, in different time periods, and how those stories connect with one another, just in a weird way.
Right.
Yeah.
It's just connected. And then now this is another way that we all get to be connected to one another through this treatment, which is pretty cool.
Yeah.
And I hope that other veterans that we all know, just not here in the Martinsburg area, but across the country, get to see this and get to explore this treatment.
Exactly. It's life saving.
Yeah.
It saved my life. It changed me.
Me too. It did. I feel like a brand new person now. I feel like my old self, but a better version of myself, if that makes sense.
Yeah.
So, doing a lot more, getting back into things.
Yeah.
There's one more thing I want to shout out somebody else while we're on here, because it's been a big help for me. JC Booth. Y'all follow him if you're looking for some mental health awareness videos. He puts them out like every week. He talks about things you can do to help with mental health. I know they've really helped me. He's been doing them for almost a year now, and I watch them every week, and they really do help. So if you want to find him on Facebook, it's JC Booth. And I guess anything else?
I would just say, I would just end with this. Asking for help does not show a sign of weakness.
That's right.
No.
It shows that you're trying to obtain strength that strength and courage that you once didn't have, that you're trying to get to. So definitely, if you are, in need, definitely don't be afraid to reach out, because it's definitely better reaching out, or reaching out to someone, rather than try to keep it all in and then self-implode.
Yeah.
Because you didn't talk to somebody to ask for help or try to get the help.
Yeah.
So it is not a weakness by any means.
Exactly.
Yeah. All right. I guess we're signing off.
Yeah.
Hope you guys enjoyed this.
I hope you guys learned something from the show. I hope you take away the fact that we're here simply to try to help people, especially veterans, the community. Everything we just said is honest and
From the heart.
from the heart. And I just like to say I appreciate you tuning in.
Yes.
Thank you.
Thank you for tuning in.